We got you updated. This is Radio Imanzi News in English.
Radio Imanzi, broadcasting from Kigali. Here is the news in English, brought to you by Fiona Umuganwa. The headlines. World Cancer Day is an international day marked on 4th February to raise awareness of cancer and to encourage its prevention, detection and treatment. A new bus station has been completed in Jihara Center in Runda Sector, Kamonyi District. The government of Tanzania launched a program dedicated to mark 100 years of Tanzania's founding president, Julius Nyerere. The fate of a 5-year-old boy trapped in a 32-meter well for more than 40 hours continues to hold Morroco in suspense as authorities hope for a happy ending. Now the news in detail. World Cancer Day is an international day marked on 4th February to raise awareness of cancer and to encourage its prevention, detection and treatment. The theme for World Cancer Day this year is Close the Care Gap and is all about understanding and recognizing the economic inequities in cancer care that prevents people from full access to essential healthcare services and facilities. The government of Rwanda has set up 5 facilities that treat cancer. Lieutenant Colonel Dr. Pacific Mugenzi, the head of the Rwanda Cancer Center, says there has been 1,200 patients since the facility started 2 years ago. Dr. Mark Hagenimana, Director of Cancer Diseases Unit at Rwanda Biomedical Center, says cancer is a disease that causes concern around the world. Rwanda has taken an initiative in collaboration with health facilities in order to fight and detect the disease.
Today we are celebrating World Cancer Day. The theme of this year is Close Care Gap. It's about improving access to cancer prevention and control services. The Ministry of Health and Rwanda Biomedical Center are working closely with a health facility to improve awareness of the general population for cancer. That's the main activity that we are doing. And again, another activity that we are doing, we are implementing in collaboration with health facilities, cervical cancer screening and breast cancer detection in different health facilities in the country. So to ensure that patients women are receiving early those services, and those who are having problems like precancerous lesions, they can receive treatment of precancerous lesions starting at health center level. But those who have like a suspected cancer, they are referred to referral hospital where they can receive a diagnosis and treatment services. What we are doing is first of all to advocate for early detection. When you come early, the cost of treatment is very low, but when you come very late, most of the time the cost of treatment also become very high. So what we are doing is we are working closely with health insurance so that people can adhere to those health insurance, because when you are having health insurance, the co-payment will not be very high. The other thing that we are doing, we are bringing some industries that can help to make a cancer treatment. For instance, actually we are producing locally oral morphine. It is a drug that can be provided to patients with severe pain. But we are also having collaboration with different industries to make sure that we can fabricate some drugs locally here in Rwanda. And again, what we are doing, we are working with different companies and industries to ensure that they provide us a drug at low cost, so that they can be also provided to patients in need at a low cost. No, we cannot say that all cancer are treated in Rwanda, but the majority of cancers are treated. I can say that we are having all treatment, almost all treatment modalities, surgery, chemotherapy, and radiotherapy. Yeah, it is different. When we see in previous years, it was not possible as we were not having radiotherapy, but over the last years, the treatment has been improved. The treatment capacities have been improved, and the majority of patients are treated. Not all. We are having some few cases that we are referring in the other countries like Europe, like India, and USA. But this is a very low proportion. It depends. In order to cover the cost, there are some eligibility criteria. So we see among them, we see if that cancer is curable. That is first one, and second, we see the outcome or the impact of treatment. So there's a list of selection criteria. So we don't send everyone. We send those people who at least you have. We know that the outcome. Usually, the management of cancer is not done at a health center level. Health center, what they can do is just a suspicion of cancer, and then refer to district hospital. When the patient is referred to district hospital, they can do advanced diagnosis, but they cannot confirm cancer. Cancer is confirmed in a referral hospital. We are having Sashuika, Sashuibe, Rwanda Military Hospital, King Faisal Hospital, and Utaro Cancer Center. Those are the only hospitals that can confirm whether a patient is having a cancer or not. Those facilities that can diagnose cancer, they are also the only facilities that can also treat cancer. So there are only 5 actually in our country.
Dr. Hajinimana talking to Radio Imanzi. Gicumbi district authorities are planning to investigate the claim that government financial assistance intended for the poor has not been reaching beneficiaries. Gicumbi residents classified as poor claim they have not been getting financial assistance given by the government. The government of Rwanda has launched a child development program where it allocates 21,000 Rwandan francs per month to those with children under the age of 2 in the first and second category of Ubudehe, people without any other source of income. A new bus station has been completed in Jihara Center in Munda Sector, Kamonyi District. The Jihara bus station will facilitate economic development in the center and simplify movement for passengers moving from Jihara to Ruyenzi and Kigali. The mayor of Kamonyi District, Dr. Nahayo Sidvet, says Jihara bus station is a part of the government's plan to build more bus stations at the outskirts of the city of Kigali in order to reduce the number of passengers that queue in Nyabugogo bus station. Rice farmers in Bugarama Valley have expressed concern that cooperative societies are taking a lot of their produce to the market without leaving them enough to feed their families. The National Cooperative Agency, however, says that the farmers must first have enough to feed themselves and their families before sending produce to the market. The farmers are demanding to be given enough rice to satisfy their families so that they won't have to go back to the market and buy it on higher prices. Director of the National Cooperative Agency, Professor Ademana Jean Bosco, says the issue has been resolved and the farmers should send their produce to the market after taking enough to feed their families. Dr. Suspense has been appointed as the new Director General of the University Teaching Hospital of Butare. Prior to his appointment, Sanzimana was the Director General of Rwanda Biomedical Center, a position he had held since July 2019. On December 7, 2021, he was suspended from RBC over matters of accountability and was under investigation. He is replacing Dr. Christian Garambe, who had been serving in acting capacity as the hospital's new Director General. Now some items of international news. The government of Tanzania has launched a program dedicated to mark 100 years of Tanzania's founding president, Julius Nyerere. The program, called Mwalimu Nyerere at 100, will be coordinated by the Ministry of Natural Resources and Tourism and will climax on April 13th in Nyerere's native village of Butiama in Mara region. Damas Dumbaro, the Minister of Natural Resources and Tourism, says the program is aimed at identifying new strategies to commemorate the work, life, and philosophies of Julius Nyerere in the next 10 years. Dumbaro told a news conference in the capital Dodoma that the new program entails showcasing of many things, like houses that Nyerere lived in different parts of the country, his speeches, and people he worked with at different levels. The fate of a 5-year-old boy trapped in a 32-meter well for more than 40 hours continues to hold Morroco in suspense as authorities hope for a happy ending. The boy Ryan accidentally fell in the narrow and hard-to-reach dry well on Tuesday in Morroco. The only solution was to dig around the well to save the child. 5 excavators deployed to the site and began digging a plot of land parallel to the well. Only 9 meters remain to be dug in the tunnel that will allow rescuers to reach the boy. The authorities have also mobilized a medical helicopter which is standing by to evacuate Ryan to a nearby hospital in case of rescue. Weather forecasts indicate that tropical cyclone Batsirai is expected to hit the eastern coast of Madagascar today, with heavy rain and strong winds spreading over much of the central parts of the island through the weekend. Currently, Cyclone Batsirai is just north of the volcanic islands of Mauritius and Reunion. Madagascar's National Office for Risk and Disaster Management predicts that Cyclone Batsirai could affect more than 595,000 families and displace more than 140,000 others. As a preventative measure, the country's Council of Ministers ordered the closure of all schools, universities, and administrative offices. In the private sector, only businesses deemed essential will be able to work, including pharmacies, clinics, and ambulances. Africa needs to raise its vaccination rate to about 36 million people a week to achieve the target of fully vaccinating 70% of its population by the end of June 2022. And even as the continent records lower cases of COVID-19 infections in its 4th wave, health authorities are concerned about the low rate of vaccination, making Africa lag behind in achieving its target, as only about 6 million people in the continent are being vaccinated every week. The World Health Organization said in its weekly report that the continent is struggling to expand rollout. Together with the United Nations Children's Fund, UNICEF, the International Federation of Red Cross and Red Crescent Societies, IFRC, World Health Organization, and partners are launching an initiative to ramp up vaccination in Africa. Europe is now entering a plausible endgame to the COVID-19 pandemic. The World Health Organization Europe Director Dr. Hans Kluge says the number of coronavirus deaths across the continent is starting to plateau. This could be due to the lower severity of the Omicron variant, as well as warmer weather making it harder for the virus to spread. Some countries like Spain are considering whether COVID-19 is now an endemic problem and can be handled more like a seasonal flu. Others, such as the Czech Republic and Italy, are planning to ease some of the restrictions in the coming weeks. But World Health Organization has urged countries to continue vaccinating citizens against the virus. Scientists have repeatedly warned that unless the majority of the world's population is vaccinated, the coronavirus will keep spreading and may mutate into deadlier and more contagious forms. The French president and the German chancellor will head to Moscow and Kyiv in the coming weeks, adding to diplomatic efforts to try to deter Russian President Vladimir Putin from launching an invasion of Ukraine and find a way out of the growing tensions. Emmanuel Macron is scheduled to visit Moscow on Monday and Kyiv on Tuesday, while Germany's Olaf Scholz will travel to Kyiv on February 14th and Moscow on February 15th. After weeks of talks in various diplomatic formats have led to no major concessions by Russia and the United States, it's unclear how much impact the trips will have. But Ukraine's Foreign Minister Dmytro Kuleba said that top-level visits seriously reduce challenges in the sphere of security and upset the Kremlin's plans. The review of Rwanda Stock Exchange on 4th February 2022. The trading session recorded a total turnover of 76,500 Rwandan francs from 1,700 shares traded in one deal on the equities market, while the fixed income market remained quiet. As the share counters closed, I&M Bank counter closed at 45. The trading session recorded a total turnover of Rwandan francs 76,500 from 1,700 shares traded in one deal. Bank of Kigali closed the counter at 247 Rwandan francs, Bralirwa at 125 Rwandan francs, Simerwa at 120 Rwandan francs, MTN Rwanda at 180 Rwandan francs, Equity Bank at 440 Rwandan francs, Kenya Commercial Bank at 370 Rwandan francs, National Media Group at 1,200 Rwandan francs, Uchuri Supermarket at 104 Rwandan francs, RH Buffalo at 526 Rwandan francs as the market closed. Currency market review of today, 4th February 2022. The Kenyan shilling buying price was 8.9 Rwandan francs and selling price was 9 Rwandan francs. Tanzania shilling buying price was 0.43 and the selling price was 0.44 Rwandan francs. Ugandan shilling buying price was 0.28 Rwandan francs and the selling price was 0.28 Rwandan francs. Burundian franc buying price was 0.49 Rwandan francs and selling price was 0.5 Rwandan francs. The buying price was 1,003 Rwandan francs on the US dollar and the selling price was 1,023 Rwandan francs. The British pound buying price was 1,365 Rwandan francs and selling price was 1,392 Rwandan francs. The euro buying price was 1,150 Rwandan francs and selling price was 1,173 Rwandan francs. With that, we come to the end of tonight's edition.